welcome to The Explainer. So today, we're diving into a condition that affects hundreds of millions of people, diabetes. But we're gonna look at one of its lesser-known complications, something that's happening silently, its huge impact on our bone health. Just to give you a sense of scale, take a look at this number, 537 million. That's how many adults, according to the International Diabetes Federation, were living with diabetes back in 2021. And what's even crazier is that number is expected to jump by over 100 million in just the next decade. You know, most of us have heard about the common signs of diabetes, things like needing to pee a lot, feeling tired, blurry vision. But while you can notice those things, there's a much sneakier and, frankly, more serious effect going on that you can't see at all, and it's happening deep inside your bones.
All right, let's get right into it. Now, to really get how diabetes messes with our bones, we got to do a super quick refresh on what diabetes actually is.
So, diabetes isn't a one-size-fits-all thing. With type 1, the body basically attacks itself and stops making enough insulin. But with type 2, the body makes insulin, but it just can't use it the right way. Now, both of these lead to high blood sugar, but, and this is key, they start from different places, which means they can affect our bones in really different ways. Okay, so here's the absolute bottom line. Diabetes is a metabolic disease, right? And that disruption to your metabolism is a direct hit on your skeletal system. It goes after its strength, its resilience, the very things that make your bones, well, bones. Before we get any deeper, there are two terms you really need to know. First up is bone mineral density, or BMD. The easy way to think about this is how much stuff, how many minerals are packed into your bones. It's one of the main things doctors look at to figure out how strong your bones are.
But here's the thing, density is not the whole story. You've also got bone quality. This is all about the bone's internal structure. I mean, think about it. You could have a really dense cracker, but it's super brittle, right? Compare that to a strong, flexible plank of wood. They might have a similar density, but their quality and their ability to not break are worlds apart. That's bone quality.
So the big question is, how does a problem with your blood sugar actually lead to weaker bones? It seems like two totally different systems. Well, let's get into the science of it, because it all happens at a cellular level.
See, your skeleton isn't just a static frame. It's actually more like a building that's under constant renovation. You've got this little construction crew of cells. The osteoblasts are the builders, laying down new bone. And the osteoclasts are the demolition crew, clearing out the old stuff. And when you're healthy, it's a perfect balance. But diabetes, it just throws a giant wrench right into the whole operation.
So how does it mess things up? Well, there are a few big ways. First, all that extra sugar in your blood creates these things called, get this, advanced glycation end products, or AGEs. These AGEs literally sugarcoat the collagen in your bones, making them stiff and brittle. Then, with type 1, you can get hormonal imbalances that mess with that demolition crew. And with type 2, you see things like lower vitamin D levels. And this one is wild. The actual bone-building cells can turn into fat cells. It literally weakens the bone from the inside out. And here's where it gets even more complicated. Diabetes almost never works alone. Its impact on our bones gets way, way worse when other risk factors get thrown into the mix. You've got this really complex web of factors. Your age, your habits, other health problems, they can all work together to amplify the damage, creating a perfect storm for fragile bones. Your age and how well you manage the disease really matter. For example, studies show that if you get type 1 diabetes before you're 20, it can mess with the peak bone mass you're supposed to build for your entire life. And on top of that, having poor blood sugar control, which doctors measure with a test called an HbA1c, is directly linked to weaker, more porous bones. And it's not just about diabetes by itself. When you start piling on other conditions, you get this huge compounding effect. Having something like metabolic syndrome, osteoporosis, or even fatty liver disease on top of diabetes just makes everything worse. It's a powerful reminder of just how interconnected everything in our body really is. Believe it or not, even the treatments can play a role. Some drugs, like oral glucocorticoids, can actually make bone quality worse. But then you have a common diabetes drug like metformin, which in one study was linked to better bone formation. It's complicated, and it just goes to show how important it is to look at the whole picture when it comes to patient care. Okay, so we've gone through the science, the cells, the risk factors, the whole shebang. So what's the big takeaway here? What does this all actually mean for you? Look, the whole point of this isn't to scare you. Not at all. It's about empowerment. Just knowing that this connection exists means you can have better, smarter conversations with your doctor. It helps you see the complete picture of your long-term health. The researchers who put together a lot of this data really said it best. They said that this bone problem adds a whole new layer of difficulty to managing what is already a really complicated disease. This isn't just some side note, it's a central challenge.
In the end, what this all does is it forces us to look beyond the day-to-day blood sugar numbers. It pushes us to think about health in a whole body way, to remember that a condition like diabetes sends ripples everywhere, deep into our bodies. It's really a call to action, to make sure we're protecting the silent, foundational strength of our own skeleton.
You know, when cancer spreads, it often finds a new home in our bones, and that creates one of the toughest, most painful challenges in all of modern medicine. But what if we could fight it differently? Not with a flood of powerful drugs, but with an army of microscopic, precision-guided healers. Let's dive into how this tiny medicine is taking on a giant challenge.
So this is the big question, right? Why is this specific problem so incredibly difficult? Well, the answer really lies in the unique, complex environment of our bones and, honestly, the limits of the weapons we currently have in our arsenal against cancer.
Okay, so before we get to the really cool solutions, we've got to wrap our heads around the problem. And make no mistake, when it comes to cancer, bone is one of its toughest strongholds. Now, here's something you might not realize. This isn't what we typically call bone cancer. This is cancer that started somewhere else, say in the breast or prostate, and then it traveled or metastasized to the bone. And that's often the most dangerous stage of the disease because the bone gives these cancer cells the perfect place to hide and grow. For decades, our main weapon has been chemotherapy, and you can really think of it as a shotgun blast. It's powerful, for sure, but it's not precise at all. It takes out cancer cells, but it also causes so much collateral damage to healthy cells, and that's what leads to those awful side effects. The dream, the goal, has always been to create a guided missile, a therapy that can seek out and destroy only the cancer, leaving all the healthy tissue alone. And this is where nanotechnology comes into the picture. Scientists are literally engineering tiny vehicles, way smaller than a single cell, to carry out this exact mission. So let's meet the hero of our story. Okay, so this is a lipid nanoparticle. At its heart, it's just an unbelievably small sphere made of fats, or lipids, basically the same stuff that makes up our own cell membranes. The easiest way to think of it is as a tiny biological shipping container built to carry a powerful cargo safely through the chaos of our bloodstream. So let's take a look under the hood here. This diagram shows us a liposome, which is a type of nanoparticle. You see that outer wall? It's made of these fatty molecules, and they create this really secure little space on the inside. What's so clever about this design is that it can carry water-based drugs in the middle and fat-based drugs tucked into the wall itself. It's like a delivery truck that has both a main compartment and a refrigerated section. It's incredibly versatile.
So what makes these little trucks such a massive game changer? Well, it all boils down to a few huge advantages. First, they're biocompatible, which means our immune system pretty much ignores them. They also act like a protective shield for the drug, making sure it doesn't get destroyed on its journey. But the most important thing, the real magic, is that they can be engineered with that guided missile precision we've been talking about to hunt down a very specific target.
But wait, it gets even better. Scientists aren't just building one kind of nanoparticle. No way. They've developed this entire toolbox of tricks and strategies to make them smarter, faster, and even more targeted. This image does a great job of showing all the different tools they have. I know it looks a little complicated, but don't worry. We're going to break down 3 of the absolute coolest strategies that scientists are using right now to turn these things into sophisticated cancer-fighting machines. All right, the first strategy is all about navigation. I mean, how do you tell this little nanoparticle where in the whole body it needs to go? Simple, you give it a GPS. Scientists can do this using molecules called bisphosphonates. Now, these molecules just have this natural, really strong attraction to bone. So by sticking them onto the outside of the nanoparticle, it's literally like putting a zip code for bone on the package. When it's in the body, it just circulates around until it finds and latches on to bone tissue, delivering its drug cargo right where it needs to go. It's brilliant. Okay, this next strategy is just so elegant. Instead of trying to build a delivery vehicle from scratch, why not just borrow one that nature has already spent millions of years perfecting? So, on the left, we've got the man-made liposomes we've been talking about, but on the right, that's something called an exosome. These are nature's own nanoparticles. Our cells make them all the time to send messages and materials to each other. You can think of them as the body's internal high-priority mail service. And because our own bodies make these exosomes, they are absolute masters of stealth and delivery. Their surfaces are covered in all these proteins that act like a specific key, letting them unlock and get inside certain cells with amazing precision. They just know how to navigate our internal systems perfectly. All right, so you've guided your nanoparticle to the tumor. Fantastic. But now you have a new problem. How do you make sure it stays there long enough to actually work, instead of just getting washed away by blood flow? The solution? You give it an anchor. This is so cool. As you can see on the left, scientists basically mix the nanoparticles into a liquid hydrogel. They then inject this whole mixture right at the tumor site. The gel then firms up, kind of like Jell-O setting in the fridge, and it creates this scaffold that physically traps the nanoparticles right where they need to be. This anchor makes sure they stick around, letting them release their medicine slowly and steadily for days, or even weeks.
A molecular GPS, nature's own delivery system, a hydrogel anchor. I know, it all sounds a little like science fiction. Which brings us to the big question, right? If this stuff is so amazing, why isn't it in every single hospital today?
Well, the science itself is definitely solid. I mean, look at this table. It shows really clear examples from lab studies where nanoparticles took existing drugs and just made them way, way better. They're getting sustained release, which could mean fewer doses for patients. They're helping drugs get into bone where they couldn't before. The proof of concept is absolutely there. The science works. But, and it's a big but, getting from a lab to a life-saving treatment is a marathon, not a sprint. Just try to imagine the challenge. You have to manufacture billions upon billions of these tiny particles, and every single one has to be perfect. It's a massive engineering problem. It's expensive. And on top of all that, you have to go through the years-long, incredibly strict regulatory process for a totally new kind of medicine. It takes a ton of work. Even with all those challenges, the potential here is just, it's too big to ignore. This kind of research represents a true fundamental shift in how we even think about medicine. When you boil it all down, what we're witnessing is the move from the shotgun blast era to the guided missile era. It's a shift away from just flooding our entire bodies with toxic chemicals and hoping for the best, and moving towards sending in tiny, programmed healers that go only where we tell them to go. This whole thing isn't just about treating one type of cancer. It's really a glimpse into the future of medicine itself. A future where our treatments aren't just powerful, but they're also smart, they're precise, and they're personalized. And it just leaves you wondering, what other diseases could we finally conquer with an army of these tiny, programmed healers?